You're listening to Ask Dr. Jake. My name is Dr. Jake Tucker, owner and founder of Good Life Family Chiropractic here on the south side of Lincoln. And I'm coming to you today with another message of hope, health, and healing. And really, I wanted to tell you a little story that we had from last week of a patient that came in after listening to us on the radio. And her husband, he was listening. He's in his car. He's a salesman. And, I was telling a story. He just got confirmation from the Holy Spirit that he needed to bring his wife in. And he came back and, told her about what I had said and what I had talked about on the radio. And she confirmed it as well. And so they set up an appointment. They came in. They told me all about what had happened about 5 years ago. She had been in a car accident, had really just nasty whiplash of her neck, went through some physical therapy to help deal with some of the problems with the pain that she was having. It helped a little bit, but within a year of that accident, she started to develop symptoms, neurological symptoms that were diagnosed as Parkinson's disease. Now, this is someone that didn't have any signs or symptoms of Parkinson's before, that was concerned about her health, that was actively invested in her health, but all because of a misalignment in her spine. And let me tell you what, her spine was messed up. That car accident had whipped her out of the normal position, and nobody in her life, nobody in the healthcare system had intervened and said, you know what, your spine isn't in the normal place. I think somebody should help you train that back into the right position. Nobody intervened. And so we brought her into the office. We did the exam. We saw the amount of neurological irritation on the nerve scan. And from the nerve scan, I was able to decide how many x-rays I needed. And I took those x-rays and it showed me exactly what I needed to see. She had ligament damage still, even after all of that physical therapy and years of going to the doctors and years of Parkinson's treatments, which were mostly just medication. She still had ligament damage. And on top of that, she had scoliosis, and nobody had told her that she had scoliosis. Nobody had told her that living with scoliosis is like living with type 2 diabetes. Not even any of the medical doctors that she had paid all of these thousands of dollars to, all the health insurance that covered those visits. Nobody told her the cause of her problem. And you might be sitting there, you might be in the exact same situation as she was, not knowing why your health is falling apart, not knowing what is going on. And let me tell you, there's no better place than here, and there's no better time than now. Waiting to find the cause of your problem is just making your problem more expensive. And let me tell you, if you don't have any health concerns right now, you're in the minority. And guess what? If you are not actively investing in your health now, it's a guarantee in today's culture that you will have to invest in your sickness and disease. If you're not paying attention to your mindset, if you're not investing in that on a daily basis, if you're not paying attention to what foods you're putting in your body, or you don't care and you just want something that tastes good, if you're not actively investing in physical fitness and exercise and getting oxygen into every single cell inside your body, if you're not actively training your body how to detox more efficiently and effectively, if you're not taking care of your spine, you are actively building sickness and disease inside your body. You're more likely to get sick. You're more likely to go bankrupt, and you're more likely to have to deal with a healthcare crisis. Now, if you don't want that to be you, I suggest that you do exactly what she did and her husband did. Pick up the phone and call our office, 531-289-7100. We're standing by to set up an appointment for you here in the office for our KCRO radio and podcast discount, 50% off of our normal fee. It'd typically be $130 for an exam, a full neurological workup, and those x-rays here, which is very affordable compared to what you'd be getting at your neurologist or any imaging center. But today, if you set up an appointment for this week, you're getting a 50% discount off of that initial exam, x-rays, and the first visit. So if we decide to do an adjustment at your first visit, because I think I can help you, that would also be a 50% discount off. So now you're talking about $195 value, all for just $95. So that would be, if you pick up the phone right now, dial 531-289-7100 and let us know that you heard us on the radio and you set up an appointment for this week. And, I went through this myself just about less than a month ago. I came into work on a Wednesday morning, typical Wednesday morning for me, fairly light shift. Most of my patients like to come in after work. And so if you want to avoid that busiest time, set up an appointment for Wednesday morning. But I went through my Wednesday morning. We saw about 20 people, was having some, really good interactions with patients, and it was coming towards the end of shift. And I had just about a 30-second break. And so I wanted to get off my feet for just a second. And I sat down and the phone rang and I saw it was my wife's number. So I picked up right away and she said, Jake, Zeke, stop breathing. I'm on my way over there right now. And I had no clue. My heart jumped into my throat. I had no clue what to do. I turned to my office manager and I said, Zeke, stop breathing. I got to go. Yeah, I went through the office as I did. I said, Zeke, stop breathing. I got to go. And I drove over there. I met them in the emergency room, and Zeke, he had stopped breathing in his daycare while he was going down for a nap. Apparently, he went from his back to his front all by himself, strong 6-month-old boy, flipped over and let out a yelp and stopped responding. The daycare workers were right on top of it. They came over, they tried to stimulate him, get him breathing again, and he wouldn't. They took him through 2 rounds of CPR, and fortunately he started breathing. And by that time, the EMTs had showed up, and they noticed that he was also seizing. He was having a seizure. And this is a kid who had no health problems for the entire first 6 months of his life. No signs or symptoms, no interventions necessary. His medical doctors, everybody was saying how far ahead on his milestones he was. He was already sitting up and starting to get ready to crawl at just 6 months old, and he stopped breathing out of the blue. So I got to the emergency room. He was still seizing, still actually struggling to breathe, crying, obviously, when he could get enough breath to let out a cry. And so I went to him and I picked him up in my arms and I just started to comfort him. And instinctively, intuitively, my hands went to his spine. And at the top of his neck, the bones that surround and protect your brainstem are known as occiput, the base of the skull, and atlas, C1, the first cervical vertebra in the neck. They had been shoved over to the side and locked up on the right-hand side of his neck. And so as I was holding him and comforting him and praying for him, I started to massage that bone back into place to get it to loosen up, to get it to open up. And as I did so, I felt his body relax in my arms. He slowly came out of the seizure. He slowly started breathing normal again. And he actually asked for his mom. He's not talking yet, but he said, and he's been saying that for the last month and a half beforehand. And so I hand him to his mom. He starts nursing and he falls asleep. And then the medical professionals step in and they start checking everything. They start by taking his blood, and then they do a CT scan, and then they do chest x-rays. And then they can't figure out what's going on, so they refer him to Children's in Omaha, and they start their workup. They start with an EEG, and they look at the blood panels after they've cultured for 24 hours, and they do a spinal tap, and the first spinal tap fails, so they get an MRI, and while he's under anesthesia for the MRI, they do another spinal tap, and they look at everything, and they say, we don't know what happened. It must have been a one-off. Meanwhile, I'm sitting there and I'm telling him exactly what happened. And I find this out later, but that morning, Mom was getting him ready for school, also getting the 2.5-year-old ready for school, my darling daughter, Annika, who has all the life and vitality and fight and fire in the world inside of her. And she did not want to put her pants on. And so while he was laying on the bed, she accidentally kicked him upside the head and neck. That's enough trauma to dislodge your atlas. That's enough trauma to dislodge the relationship between your skull and C1. And if you've had any type of trauma like that, whether it's a car accident or you happen to be a 2-year-old and fell off a swing like my daughter did just this last weekend, that's enough to dislodge C1. And yes, my daughter had that, but I was right there to fix it. Whereas with Zeke, it took him going to daycare and having a respiratory breakdown for us to be able to figure out the cause. And I thank God for those daycare workers and their vigilance and being able to keep him alive. That would have been a SIDS baby had it been any other baby in any other place that didn't have the people around him to take care of him like that. But if I wouldn't have been there to check his spine, that seizure might still be going on. He would be on seizure meds. He would be having breathing problems. But thank God I was there and I was in the emergency room. And thank God for my past. I went through the exact same thing as a baby at just 2 weeks old. The day of my first well check, after the pediatrician at my birth said I was fine, and this different pediatrician at 2 weeks old said I was absolutely healthy, I quit breathing for the first time and turned blue down to my elbows, my mom said. She said I looked at her in the eyes and just my eyes screamed, "Help me." And she didn't know what to do. She was able to resuscitate me, but she took me to the ER, and they weren't even going to let her in, but she convinced them to monitor me. And I quit breathing 14 times that night. And she went through 6 months of what I went through for 2 days at Children's. Test after test, retesting, testing again, getting a different opinion from a different doctor, dozens of specialists, nobody able to find the cause of the problem until my mom's best friend got them to bring me to a chiropractor. And that chiropractor, just like I am, was trained in how to take care of not just the pediatric spine, but everybody's spine, because that's what he specialized in. And he looked at my spine and he found that atlas, again, C1 at the top of my neck, was shoved over and wrapped around my brainstem such that the vagus nerve could not send enough impulse down to my lungs to get me to take a breath. When I turned my head to nurse, or when I laid my head over in my sleep, I would quit breathing immediately. He did one adjustment, and I've never had a breathing problem since. And I did one adjustment on Zeke, but I didn't leave it at that. I adjusted him 20 times over the next day, only as I saw needed, because I would adjust him and then it would go back, and I would adjust him and then I would go back. That amount of damage, that amount of trauma that he had because of his sister kicking him in the head, that I had in my spine because I was born via C-section, and the doctors pulled me out with my head lodged inside the birth canal without any knowledge of how to properly take care of the spine from a wellness perspective, making sure that things are in the normal position. They had no clue, but I do, and that chiropractor did. And for that reason, I was prepared to be here on this day for my son. And very, very likely, if you're listening to the show, for you, God prepared me in that moment 37 years ago for you and for your health problem and what you're dealing with, whether that's neck pain and back pain or headaches or Parkinson's disease or hip pain or sciatica or the combination of a number of these, or heart disease or cancer or diabetes. And you've been spending tens of thousands, if not hundreds of thousands of dollars looking for an answer, looking for a cure. Well, I tell you what, the cure is not in a pill, potion, or lotion. It's not in a treatment. What it is God placed an amazing healing power inside of you at conception. It formed you. It grew you out of your central nervous system. And that power, that innate intelligence that each of us has, is still inside you. It heals a cut on your hand, arm, or leg. It heals you when you have heart disease. It heals you when you have cancer, so long as there's no interference. And if you want to make sure that there's no interference to your central nervous system, I suggest you pick up the phone and call our office right now, 531-289-7100. I'm Dr. Jake Tucker. For me and my team here, have a great day, and I'll see you again tomorrow for another episode of Ask Dr. Jake.